So today we do something different again. For the first time on Take It From Us, we play a broadcast from Mad in America Radio. Again, I was made aware of Mad in America Radio on the Facebook page of BINZ, B-I-N-Z, a medium for news and opinions on mental health, mostly from people with lived experience. And I would encourage people to sign up to BINZ because it brings me a great deal of contemporary thinking about mental health and things like Mad in America. Now, let's just talk a little bit about Mad in America. Its mission is to serve as a catalyst for rethinking psychiatric care in the United States and abroad, and to remake psychiatry. That's a term that they use, remake psychiatry. Mad in America believes that the current drug-based focus of care has failed society and that scientific research, as well as the lived experience of those who have been diagnosed with a psychiatric disorder, calls for profound change. So today we listen to host James Moore interview a Dr. Mo Hanna, who talks about her personal and professional experiences of the mental health system, psychiatric drugs, and how this has impacted her daughters and family. The interview has outspoken views opposing the use and value of psychiatric medications, particularly antidepressants. Take It From Us urges listeners to never make any rapid decisions about their medication without consulting their clinician or prescriber. Here's the interview from Mad in America Radio.
Mo, thank you so much for talking with me today. Could I start by asking you to tell me a little about your background and how you came to be involved with psychiatric medications?
Well, I'm involved with psychiatric medications on several levels. First, I have had a couple of my children who are now young adult children, one deceased, but one young adult child, both of whom were on antidepressants with some negative outcomes. But I'm also a psychologist. I practice psychotherapy with clients, and I'm also a psychology professor at an undergraduate school teaching psychology courses in the area of clinical psychology, which is, the psychological area that deals with mental illnesses and treatments for mental illnesses. So I teach about treatments and study treatments, and also have had my own personal experience. I myself was on an antidepressant for a number of years, although I have not been using any kinds of psychoactive drugs in the last couple of years, and have recovered quite well from all of that, which does not happen all the time and which was not the case for my daughters.
Thank you, Mo. And I wanted to ask about your family experiences of antidepressants in the mental health system. I understand that both of your daughters, Monique and Alex, had experiences with mental health services. Could you help me understand their experiences? For example, what was it that led to Alex's treatment with antidepressants?
Well, to understand what happened to Alex, you sort of have to understand what happened to my older daughter, Monique, who took her life at the age of 20.
I'm so sorry to hear that, Mo.
Around the time that happened, of course, the family was devastated by this. It was very unexpected. And at the time, I had thought that Monique's death by suicide was due to her depression. But in subsequent years, and especially in seeing the experience that Alex has had in trying to withdraw from the drugs and learning more about the side effects, especially when people are first going on these antidepressants, as well as the withdrawal effects, I was more aware of side effects, actually, than I was of withdrawal effects in my earlier years, but still not really cognizant of what these drugs can do, especially when you're going on them, and especially for certain people, because not everybody reacts the same way. Some people react extremely dramatically with terrible symptoms, even taking 1 or 2 doses of these pills, and others seem to do just fine, at least for a while. In Monique's case, Monique was a sophomore at NYU taking acting training, and she was really a brilliant actress and a very artistic type of person with a lot of strong emotions. And she became quite depressed. And around the time she came home from a school break around Christmas, and it was during her sophomore year in college, as I said. And the natural thing that I thought to do, of course, was to refer her to a doctor, which is what we did. And, it's a very long story and a very convoluted story, but We did our very, very best to get the best treatment for her, both on an outpatient basis, seeing outpatient therapists, and also eventually putting her on an inpatient ward for a brief period of time, a couple of brief periods of time. Mm-hmm. And what they basically did during the entire period she had gotten depressed, or when she was seeking treatment, which was about a 4-month period. It was not that long. She was really only depressed for approximately 4 months before she took her life. But one of the things that happened, 2 things that happened. One is that it was very clear to me that the therapists that were working with her, the doctors, were not really seeing the situation clearly at all. And they were missing the suicidal thinking. They were not paying close attention to it. And I kept trying to tell them, look, she says things to us at home that are very, very scary. And they seem to downplay that. The second thing that happened is they put her on and off various antidepressant medications. She would take them for brief periods of time. It was very difficult to get her to pay attention, to do those things that other people were feeling were the best things for her to do. So she was going on and off these antidepressants. And at one point, she started to express suicidality. And long story short was she was in an inpatient setting for a couple of weeks. They treated her with antidepressants. They discharged her on antidepressants. She then saw a private psychiatrist who put her on another type of antidepressant. And then 3 days later, she took her life. So around that time, of course, after that happened, I was very concerned about my other children. At the time, I had 3 younger children. Monique was the oldest. Alex at that time was, I believe she was 15, so she was in high school. And saw her pediatrician, and in a discussion with her pediatrician, decided that perhaps she should go on an antidepressant as a precautionary measure because her sister had taken her own life. Looking back now, of course, a very foolish thing to do, something I would never choose to do now. But at the time, it seemed like absolutely the logical thing to do, and was recommended by her pediatrician. And I must say her pediatrician seemed a very, very good person, a very well-meaning person. And I don't think she in any way, shape, or form herself understood what the possible implications were of putting Alex on an antidepressant, nor did anybody at the time, mention to me that Monique's suicidality could have been caused by the antidepressants, because I will tell you that she was not suicidal before she started on the antidepressants.
Mo, firstly, it's tragic to hear that your whole family went through that experience. And I wanted to ask, in relation to how Monique was treated, what you felt led to that refusal by mental health services to listen to Monique, because it didn't sound like they listened to her or to you.
It's very hard to know why the mental health folks did not listen more closely and did not guard her life more closely, because it was very obvious to me. Once she became suicidal, it was obvious to me that she was very suicidal. Why these physicians and the people that worked with her, for example, in the last time she was hospitalized on a locked unit, and then they discharged her, and I told them, I think she's still in danger. And indeed she was, because she took her life about a week to 10 days after she was discharged. Why don't they listen? It's a very curious question. I cannot really answer that. I will tell you, I'm a psychologist, I'm a psychotherapist, and I, both based on that experience, but really just based on my own training and my own ethics, know that you have to listen very, very closely to the patients, because they know themselves the best. And the other part, though, is this is a big issue that I think many people struggle with and suffer from. And I think many parents would agree with me that when you have a young adult child, Monique was 19 at the time she became ill, 20 at the time when she died. You have a child that age, once they're 18, they can pretty much do what they want, legally speaking. And so the HIPAA laws, the federal HIPAA laws state that, a parent cannot get information from a provider about what is going on with their young adult child, an 18, 19, 20-year-old. And so if the way that the deep depression, for example, and this is the way depression sometimes presents. It's depression, sometimes the so-called bipolar disorder, if there is such a thing. When people have relatively severe symptoms, very often they do become negative towards the people they love. They become hostile. It's part of the condition, and it needs to be worked with, and it needs to be perhaps gently confronted. But what happens is these care providers just pretty much cut out the parental voice. And I'm not talking about parents who are abusive. I'm talking about parents who are really trying to do their best to help their young person. And if the young person says, no, I want to deal with this on my own, even if they are in danger, they're pretty much not allowed to participate in the treatment. So that's one of the things that happened with Monique's care. So you can't say it was entirely the fault of the providers. Monique had her own voice, but it was also part of the condition that Monique was going through, that she was not willing to interact with me, which is very ironic because Monique and I were, as they say, like white on rice. We were as close can be. We were a very close mother-daughter type of, we had a very close mother-daughter, really almost a best friend kind of relationship. So there were many factors that entered in, but certainly I believe at this point that the antidepressants pushed her over the edge. That is my belief. It's impossible to prove that, of course. But she, as I said, she was not suicidal before. She was depressed, but not suicidal before she started on the antidepressant regimens.
It certainly sounds like had the care providers listened both to Monique and to her family, and they'd paid more attention to Monique's needs, that this tragedy could have been prevented. And as you say, surely there must be a sensible compromise around listening to the family's needs in addition to those of even an older child. I can see that if the family wishes are not taken account of, that could easily lead to isolation. Oh,
yes, absolutely. And especially, when you know that the brain doesn't develop fully now. We know now, age of 25, and for all we know in 10 years, we'll say it's 35. But a child of 20 or a young person of 20, their brain's not yet completely developed. And so when they have these kinds of mental struggles, they really can't do it on their own. They really can't do that without family support. And I'm talking about good family support, loving family support, not abusive family support. And certainly in Monique's case, as I said, she had a very strong family support system that was really pretty much cut out of the picture.
It's clear, Mo, how close you all were. And I wanted to ask about Alex. I can't imagine the place that Alex must have been in, having lost a sister in this way. How did that impact her?
Well, she went to see a pediatrician, as I said, and the pediatrician placed her on Lexapro. And when Alex went on Lexapro, I don't remember because it was that was many years ago. Alex is now 25, so that was when she was 15. So it was shortly after Monique took her life. And actually, shortly after that, probably several months later, I myself went on Prozac. And I actually found a lot of relief being on Prozac. One of the complicating factors for me has been I have heard from people that they feel better on these drugs, and I will tell you that I felt better on Prozac. However, there's two things to that. One is that we don't know why you're feeling better. And my suspicion is that it really sort of numbs the brain, okay, so that you don't really, it's not really curing your depression. It's not really curing anything. Basically, it's just sedating the brain. And you care less about what you are thinking and feeling. So that's, I think, part of it. I didn't also, when Alex went on the antidepressant, I cannot say that I noticed any severe side effects. But the big problem with Alex's treatment was it was like nobody was really minding the store. And I, unfortunately, as a mother, was brainwashed about these drugs up until I really saw very clearly with Alex's withdrawal problems what these drugs do. And then I started to really dig into the research and the reading and learning about the problems of these drugs. And so she was on, as I said, a long period of time. And I think this happens to many people. You start on an antidepressant. You see your doctor every 3 months or 6 months or however often it is for a so-called med check. They talk to you for about 15 minutes. That's the model in the United States. And then you just go on your merry way. And so that's what happened with Alex. And I think that happens probably with most people. It actually happened with me. The doctors in no way, shape, or form say, let's talk about how to get off these drugs. Let's talk about weaning off these drugs. Let's talk about what the possible side effects and withdrawal effects are of coming off these drugs. Not a word about that. Not a word of caution about what can happen if you do try to get off the drugs. So I know what happened over the time with Alex is Alex wanted to get off the antidepressants. And I think she probably started to try a couple of times and had a difficult time and then just sort of abandoned that approach. But she eventually did go off when she was on a trip in South America. And she actually weaned not as slowly as you're supposed to, according to the best authorities that we know now, which is surviving antidepressants and other people online that really have studied this on a broad population basis, from people who have reported about their symptoms. But she was smart enough to try to go off slowly, if not slowly enough. And at first she was fine, but about 3 to 4 months after she withdrew, she started getting very severe symptoms. Right. So she literally stopped taking the Lexapro after weaning. Like I said, about 3 to 4 months later, she was okay. She had some mild irritability symptoms, some mild symptoms at first that she pretty much, I think, didn't recognize as withdrawal. And then about 3 to 4 months later, she started having very severe symptoms, which one of the worst and one of the earliest symptoms was she could not sleep at all. She had what you would call total insomnia. And I know this because I was very much by her side during this whole period because she was in so much distress. So she was having a lot of anxiety, very, very high anxiety, a lot of obsessive thinking, a lot of rumination, a lot of guilt, feelings of worthlessness, really, really horrible stuff. And I will tell you, James, she never once in her entire life had symptoms anything like this. It was very, very clear to me it was drug related, that it was not, quote unquote, a mental illness returning, which so many people are told when they report this to their doctors. She never had anxiety. If anything, Alex was a non-anxious person and also a person who had great sleeping habits. So what was going on with her? It was as though she was an entirely different person.
Alex's experience has a great deal in common with others that I've spoken with, particularly that when starting these powerful drugs, not being given the information that she needed to make an informed choice. It's difficult to know whether prescribers know this and are trying not to scare their patients, or if they genuinely don't have the information or understanding to help their patient make a choice about benefits versus harms.
That's correct. However, if you and I and so many other people who are working on this issue are able to find out this information, why can these doctors not find out this information? If they really interviewed their patients, if they really paid attention to what was going on while patients were withdrawing, and if they dug into the literature and started reading material by folks like Whitaker and Bregan and all the others who are documenting these problems, they would have the knowledge and information they need to warn people. Because, you know, if Alex had been warned by her prescriber, first of all, not to stay on it for 9 years, you know, she was left on it for 9 years, and without a word about withdrawal, she really chose to go through withdrawal herself. She was the one who decided to try to get off the drug, and in all honesty, it was a very courageous thing of her to do, to go off her Lexapro without any real support from the medical system, and doing her best to do it the right way, and still suffering absolutely profound withdrawal symptoms. So the other part of this, James, is just my own feelings about having been a psychologist who, while I was not pro-drug prior to this. I had very mixed feelings about these drugs all along. Yeah. But I would never say to a client, my typical position with clients used to be, it no longer is, well, if you feel you want to try an antidepressant, go ahead and try an antidepressant. And I would do the psychotherapy part. Of course, as a psychologist, I don't prescribe drugs, can't prescribe drugs. I'm very happy I can't prescribe drugs, and work with people in non-drug techniques and teach them self-help techniques and use various kinds of therapies. And now, of course, my tune has changed, and I honestly do discourage people from starting on the drugs if they haven't already started. And I absolutely warn people who are on the drugs about all the potential withdrawal effects, talking to them about the possible impacts of going off the drug. Although I also talk about the desirability of going off the drugs, because these drugs are by no means are benign on the rest of the bodily systems, as we know. And I also talk to them about the 10% method. And by the way, I have also changed how I teach my students. When I teach, for example, abnormal psychology, which I'm teaching this semester, I talk about these drugs in very different ways than I used to.
Yeah, Sheldon Brown back on Mental Health Radio just for the last few minutes of our show, and mental health remains in the media spotlight with the Herald series called Break the Silence. So that series, Break the Silence, is continuing to have an impact. The police remain a major force in mental health, too, with a report just out that mental health call-outs to police have almost doubled in a decade to 1 every 13 minutes. That's 1 every 13 minutes. The police are being criticised as well for a policy that apparently they have of turning away recruits taking antidepressants. And advocates and critics of this policy say that stigmatises mental illnesses. And of course, we were talking by broadcasting the Mad in America radio interview with Dr. Mo Hanna, all about antidepressants. That clearly was a very controversial view from Dr. Mo Hanna, and I just stress again that anyone who has listened to that, who has maybe some concerns about her views about the impact of antidepressants, should talk to their clinicians or prescribers and couple that with going online. So this has been Mental Health Radio. Take it from us. I'm Sheldon Brown. We'll be back next week with an emphasis on youth.